Mayor and council members, my name is Taryn Perez. I'm a medical student at U of A Phoenix, but I'm here in a personal capacity, and my views do not represent those of the university, nor those of my employer, the VA. I'm also a constituent of Council District 6. I, alongside 494 of your future physicians and healthcare providers, are asking you to vote no on this ordinance as written and work with your stakeholders in harm reduction, street medicine, and public health to revise the ordinance before an additional vote. Street outreach-based harm reduction has been part of my life for over 12 years. I have also studied the provision and quality of care for veterans living with opioid use disorder for the last decade. In that span of time, the relationship between harm reduction and the medical community has changed immensely. While harm reduction was once stigmatized and excluded from medicine, it is now embraced and welcomed into hospitals and clinics. As a matter of fact, the VA itself now offers harm reduction to veterans at many sites across the country. However, this body seems determined to stop this forward progress toward a kinder, more humane future for people who use drugs. Despite the large body of evidence indicating harm reduction is efficacious in reducing harm and illness associated with substance use without increasing it, we are choosing to ignore the evidence and cater to unsubstantiated public fears towards people who use drugs. These unsubstantiated fears do not outweigh the actual human cost of withholding services from people who use drugs. Council members, whether you like it or not, you are elected to also represent your constituents who use drugs or who happen to live an unsheltered life. Do you see this map? It is from the CDC's National Center for Health Statistics. Do you know why Arizona is colored differently than 47 other states? We are one of only 3 states that experienced an increase in overdose deaths in the last year. Almost all overdose deaths are preventable. Clearly, what we have already been doing was not enough. Do you think that at a time like this for Arizona, that withholding services from people who use drugs is the right thing to do? Harm reduction is a moral imperative. Please do not fall on the wrong side of history in the making by voting for this ordinance. Instead, reconsider your options with your stakeholders at the table. Thank you for your time.
With Street Med Phoenix. I'm also a proud Phoenix native. Our city parks are where I once was one of those children who was playing in the Little League soccer team. I also ran through these parks as a cross-country athlete, and now I walk each day with my dog. The shared sense of belonging and connection these spaces provide for all members of our community, including those experiencing homelessness, are invaluable to me and our city. With the number of unhoused individuals increasing annually, the parks offer refuge from our extreme heat, often 12 degrees cooler than the surrounding asphalt, which can be the difference between life and death. I'm profoundly disappointed to see item 46 being discussed today. I'm disheartened by the thought that on my daily walks through these parks, both as a civilian and a medical volunteer, I would face a misdemeanor charge for providing kits designed to save lives. If the simple moral act of saving a life is not reason enough to reject this ordinance, I implore you to consider the severe financial burden you are voting to impose on the city. You are trading cheap, proven prevention for expensive, chaotic, and burdensome emergency response. For every 3 fatal overdoses, the government's public safety and criminal justice costs increase by an average of $150,000. I must emphasize the burden this places on our already strained medical system. Street medicine programs like ours alleviate the load on our emergency departments by managing chronic conditions and providing preventative medicine. As a future physician, I will inherit the consequences of the decision made today. I urge you to consider the physical suffering and the massive physical costs this ban will incur. Thank you.
Catherine Miller. For 3 years, I coordinated and helped lead Street Medicine Phoenix. I'm now in medical school, continuing a career focused on addressing gaps in a healthcare system that does not adequately serve people experiencing homelessness. I'm here speaking today sitting with about 20 other busy medical students. Based on item number 45 and your comments and the public's comments, I understand that this issue is based on safety concerns, and I take those very seriously. I want to address that goal directly because this ordinance will not accomplish it. Street medicine teams do not draw people experiencing homelessness to parks. These teams go to parks precisely because that's where patients already are. Policies that resist medical outreach focus on removing visible responses to homelessness rather than addressing its drivers. That approach has repeatedly resulted in displacement without resolution, moving people from place to place without while eliminating stabilizing services that reduce harm and keep people safe. From a systems perspective, this ordinance misunderstands cause and effect. When medical outreach is restricted, people do not simply leave, they get sicker. Care is pushed downstream to the busy Phoenix Fire Department, emergency departments, and hospitalizations that are more expensive and less efficient. Delayed care becomes crisis care. This burdens taxpayers, increases preventable deaths, and does not improve conditions for families using those spaces. An analogy I have is building maintenance. If a building has a persistent leak, we don't make it safer by removing the maintenance crew simply because residents don't like seeing repair equipment. We fix the leak. The maintenance crew doesn't cause the problem, they respond to it and prevent further damage. Removing them allows the underlying issue to worsen and creates more visible harm, not less. In the same way, homelessness is the underlying issue here, and banning medical care does not address the root cause of why people are in the parks in the first place. If the council's goal is safer parks, I respectfully urge you not to prohibit care without providing a clear, realistic, and accessible alternative. Thank you very much for your time.
Thank you.
I stand alongside many other healthcare workers, community members, and medical students, including many of my fellow peers online, and urge the council to vote no on this ordinance. I'd like to mention that the disagreement surrounding this ordinance is not contained to this chamber. A petition in opposition to this ordinance has already gathered around 500 signatures, reflecting distinct community disagreement. My original speech echoed and agreed with many of the opinions offered today about the importance and effectiveness of preventative medical care and harm reduction programs that meet people where they're at, that they improve the health of our unhoused community members and reduce healthcare burdens. So I'd like to offer an educational perspective not yet considered. Administering medical care in public places as a medical student has empowered me in my future practice as a physician to appropriately understand and compassionately treat people experiencing homelessness. Medical outreach and harm reduction programs like Street Medicine Phoenix plays a vital role not only in providing care to people experiencing homelessness, but also in training future physicians in social determinants of health, harm reduction, and system-based care. Operating under licensed clinician supervision, students like myself learn to practice ethical, compassionate, and cost-conscious medicine, strengthening both public health and the future healthcare workforce serving Phoenix. I respectfully urge you to vote no or table this ordinance for further collaboration with key stakeholders. Thank you for your time.
Claire Richards is next, followed by Nicole Rodriguez.
Good evening, Mayor and members of the City Council. My name is Claire Richards. I'm a first-year medical student at the University of Arizona College of Medicine, Phoenix, and a resident of District 7. I am also an overdose prevention lead for Street Medicine Phoenix. I want to begin by acknowledging the length of today's meeting and the fatigue we are all feeling. It's clear from both the public testimony and comments from council members and the Vice Mayor that there are shared concerns about the language of this ordinance and its potential unintended consequences. It was stated earlier in this meeting that this ordinance was not drafted using data on the effectiveness of harm reduction programs or their impacts on overdose deaths or use of emergency services. It was also not drafted with the input of the community organizations who are experts in this field and are so ready to partner with you. Given the seriousness of those outcomes and the concerns raised today about the ordinance's clarity, I respectfully urge the council to not move forward with this hasty vote. Instead, I would ask that we revisit the Vice Mayor's motion and initiate a collaborative review process. This could include a small working group or subcommittee with Parks and Recreation, concerned neighbors, public health officials, federally qualified health centers, street medicine teams, and community partners who you heard from today. Slowing down in this moment is not inaction. It is responsible leadership, and I think you know that. We all want safer parks and healthier communities. The last thing we want is to exacerbate the existing issues the Phoenix community faces. I urge you to let the data and not the stigma or discomfort guide this vote. Thank you for your time.